Curiosity regarding the effects of drugs and alcohol is common. All countries have laws limiting their usage, but every place has some people who want to try them and others who don't. Everyone's different. Drugs, which include alcohol, are described as psychoactive substances. This means that once they are absorbed into the body, they alter the way the brain functions. In general, people use drugs to induce a pleasant state, but they have many short-term effects: an alteration of senses and perception, numbness of the brain and body, hunger, vomiting, agitation, or feeling down or happy during or after consuming. Reactions caused by drugs and alcohol are unpredictable. They vary depending on the person, substance, and context in which they're consumed. Some people use drugs and alcohol in a recreational manner. They do it for their pleasure on an occasional basis and encounter few or no adverse effects. Others use drugs and alcohol in an attempt to relieve psychological suffering. If the problem behind the suffering doesn't get resolved, it can lead to addiction. Addiction is characterized by an almost uncontrollable need to use substances and by symptoms of withdrawal such as headaches, shaking, or nausea when the person isn't using. When it comes to cannabis, research shows that its long-term usage can lead to developing issues with memory and concentration. Cannabis can also increase the risk of developing a mental illness such as psychosis or schizophrenia. There are questions we can ask ourselves to reflect on the healthy usage of drugs and alcohol. Does my usage negatively affect my relationships or keep me from participating in my usual activities? Do I feel pressure from others to use or drink? Can I still have a good time without using substances? Are there other ways to reduce stress? No matter the answers, thinking about the physical and psychological effects of drugs helps us make informed choices.